All right, welcome everyone in the session of Life After MRCS, where we are going to learn or we are going to have some of the information regarding the life after the MRCS. So, this session is about how to secure jobs and the training posts in the UK. So, we are here, and I hope all of you will enjoy and have much more information regarding this as well. Our agenda for tonight is we are going to start with our guests' introduction, and then we're going to talk about some of the EPIC, how you're going to do the EPIC verifications, how to do the OET stuffs, how to get the registration in the GMC, what are the relevant courses you can achieve in order to enrich your CVs, about the clinical audits and the QIPs, about the research and the publications as well, and how to construct your CV in order to get the job through the track, and also how to enrich your portfolio. And through the Oriel, you can uh, simply apply for your training post. And in the last, we will have our question and answer session. So let's not have wait for too long. Let's first of all introduce our guests in the very first place. So Dr. Harshal and Dr. Ashwarya, very big congratulations to both of you for passing the MRCS, of course, and also achieving this such a great thing as a SU3 post in the general surgery in the East of England deanery NHS UK. So, Dr. Harshal and Dr. Ashwarya, can you just both of you introduce yourself?
Hi guys, am I audible to you all?
Yes, you are audible. Yes.
Hi, as I introduced by Atik sir, my name is Harshal. Harshal Padikar. I'm one of the candidates who has secured an ST3 general surgical post in training this year. I've been with Atik sir for my preparation for MRCS Part B. I would say I was quite lucky to be one of his students, and I was so moved by his teaching patterns and what he taught me within a month or 20 to 30 days has helped me sail through MRCS Part B, I would say. Uh, so yeah, that's the short introduction from my side. I got a job in NHS in last year, May. Since then, I've been working on my portfolio to improve as much as I could so that I could secure a training post because that was my ultimate aim towards becoming a consultant. That's all from my side at the moment. We'll discuss more about me as we go through our presentation as well.
Hi, I'm Aishwarya. So I, along with Harshal, have attended Atik sir's classes, maybe a little more diligently. I think I wasn't just a 1 month candidate. I was a proper 3 to 4 month candidate. And thanks to Atik sir and all of his notes, especially anatomy, we were able to complete our MRCS, get our GMCs done. We've both come last year, May, and we have worked towards our portfolios and luckily got in the same deanery East of England for this year. Yes, and I'm sure we'll have more to discuss along the way.
So that was brilliant. Really, I'm so delighted. I'm so proud, and I'm also hats off to both of you. And once I get to know that you guys are together as well, so that's delighting, as and with a very joyful situation for me as a mentor. All right, so let's go for the some of the things that we have decided to talk with all of our candidates who are waiting for all of those things. All right. So the first thing that we want to talk about the EPIC verification. So we are not going to go for in details for each of the agenda for tonight because our goal is to cover mostly about the CV and the portfolios that you guys really need to overcome, and you guys really want to know how you're going to do that in order to achieve a job or a training post. Okay, but suppose you are giving your MRCS or you are thinking to join the MRCS, right? So what are the steps that you need to have? That's what we are going to clarify in the very first slide, but with a very short things. Okay, about the EPIC verification videos, you can have this in the YouTube that I have uploaded maybe 1 year ago, and which you can see. You can just simply search the EPIC verification step by step by IMG Academy, and like you will get full of the step wise verification process for the EPIC. Okay, so you need to do your verification for your primary medical qualifications, also your MRCS certificates or the later. These things needs to be verified in order to get the GMC registration done. That's what we're going to talk. Okay, about the GMC registration, before you're going to do the registration, they are going to have a requisition for English proficiencies. That's where mainly the OET things will come, right? So OET, you can do the OET or you can do the IELTS, but I should suggest that you should go for the OET. Why? Because this is much more easier, right? In order to overcome, especially in the speaking part, because this is mostly similar or nothing similar, like nothing towards the speaking effort. Because once you are going to done with your communication part in case of the MRCS, this will become nothing to you. Yeah. So I think you can give the OET, and we are going to arrange the OET for you guys. If you guys want to learn about the OET, we can talk about that, and you can have the OET as a course as well from the IMG. So after you are done with your OET as well, so what you can do is you can go for the GMC registration. Okay, here the things might be a little bit tricky, but if you guys want, about a detailed video about how you're going to do the registration about the GMC, then we can have this for another session maybe, and we can clarify each steps for you guys maybe, right? If Dr. Harshan and Dr. Ashwira agrees on that as well, so we can do that. Okay. About the GMC, in the very first place, you need to learn about the eligibility check. So you need to have one membership done, right? Either PLAB or memberships, you need to have it. So suppose we are thinking about the surgeon, so you will go for the MRCS in the very first place. So once you are done with your MRCS, and also you have your OET done, also your EPIC done with your primary medical qualifications, then simply go to your GMC online, through which you can just register your GMC online account in the very first place, and then you need to submit all of your primary medical qualifications, the MRCS, through the EPIC, and then submit your OET results, the desired results, which is grade B, I guess, and then you need to submit your applications, and after that there will be some time they will take, and they will check all of those things, and they will give the final decisions that you have been a GMC registered doctor and you have the practice license to practice in UK as well. So yeah, that is not that much tough. I had that done within maybe after 3 months after my MRCS, once I have completed that. So it is not that much tough, but it should be done just after you have your letter from the RCS. Okay. The next thing about the relevant courses, I think Dr. Ashwarya can put some of the information on that regarding some of the relevant surgical courses that you can have or you want to do. I think that will be much more better if Dr. Ashwarya can give some of the insights on that. Dr. Ashwarya, please.
Yeah, sure. So quite frankly, we get really intimidated by this entire process of what we're expected to have and what gives us a better prospect in getting a job in UK. One of the things being the relevant courses that we can do. First of all, personally, both Harshal and I had only done our ATLS before coming to UK. There is an added advantage, which if you have finished your MRCS Part B, you would also know that by doing the CRISP, it does give a bit of an advantage in understanding how things are managed over here. As junior doctors over here, they have to follow the CRISP guidelines, which is the ABCD protocoled manner of management of the acute unwell patient. So they will expect you to know how to handle these things, especially if you're coming post MRCS. And it's not mandatory to have all the courses completed by the time you enter in for a job immediately. But if you look through the person specification, there are specific courses like how it's mentioned over here, the BLS, the CRISP, ATLS, which help and give an upper hand in getting these jobs. Of course, that being said, it's not, again, mandatory to have each and everything. Whatever is best according to your ability. And of course, there is obviously the money amount that needs to be looked into. So whatever is possible from your aspect, please put in your efforts for it. Communication-wise, yes, Teach the Teachers by Oxford and communication is again another course which gives them bonus points. We call them brownie points. So having that does help in giving proof. These are more documented proofs of how you're good at communication, how you're good at handling these patients, especially you have to be really well versed with communication when you're talking to these patients, and be patient yourself, which is something that's covered through these communication courses as well. But yes, if you can't do the communication courses, I think it's completely fine. ATLS is helpful. CRISP, again, is helpful. If I have to choose one out of all of them, I would say CRISP, in fact, not ATLS, because it's actually something that's taken very importantly by junior doctors over here. And BLS and ALS can be done alongside if you're planning as an SHO, if you're coming after PLAD especially, then that would help a lot for that as well.
All right. So yeah, that's a very nice insights. Thank you, Dr. Ashwarya. So I think the most important thing in order to get a job is to do some audits and the QIPs. Yeah. So thing is, in case of our subcontinent, in Bangladesh or in India, we really don't do those kinds of audits and the QIPs, the quality improvement projects. We don't do those things, but these are very easy things to do. If you know those things, then it will become so easier for you. And like within a week, maybe you can go for a first phase, then the second week, second phase, third phase. You can go like, in a various ways of doing that. So I think you should have done that. And also, I would recommend you guys, like, if you guys really want that, okay, you guys want to learn and you guys really want to know how to do the audits and the QIPs, maybe we can do another session regarding the audits and the QIPs in a, with a special session, because if we are going to mention how you're going to do that, it will take about hours to complete all of those things. So maybe we can do that on later as well. And also, I think Dr. Harshal and maybe Dr. Harshal, you guys can mention about the audits and QIPs and the research, how it was valuable in order to make your CV enrich, or your portfolio to pop up from among all the other hundreds of other candidates, right? So you guys can mention. Dr. Harshal, please.
Exactly. Thank you. So, just to add a caveat about the relevant courses that you should be doing, as Aishwarya said, CRISP is actually very important in this setting. Given the fact that we were trained in general surgery back in India, that gave us an upper hand in all these aspects like communication, the CRISP protocol, or ATLS, ALS, BLS. So I think just because we did not do the courses but had our training done, that gave us an upper hand. But if you're someone who's not formally trained in general surgery and is doing a job in general surgery, these courses are quite important because these will form the basic background of your whole surgical career in future. And they are looking at someone who's safe, who can manage these patients quite safely and effectively. So these courses will definitely come in handy. And as she said, you have to have that ACE points wherein you will be put as a different candidate than the people who have just not done courses at all. We see influx of several applications these days. That's all about the courses. But when we come to audits and research, as I said, we've been trained formally in general surgery, which involved us presenting a thesis and dissertation, and getting a final thesis approved from the university. So that research topic we did over the period of, say, 2 years in our training. And that was something that put us at a better position because we knew and understood what was the research, especially what is the research and how to perform a research, what are different type of analysis, what are different type of tests that you put in, what is the ethics committee approval. These were asked to us during the interviews as well. So if you have an idea about how to go about it, it definitely makes them understand that you're not someone who's just read something from a book and presenting it. Rather than you've done something, you have a formal degree, you have a certificate for it, you know how it is to be done and how are the nuances that need to be tackled when you come in with any problems while performing these researches. We had multiple case presentations to our names. We had some papers as well, some international presentations by the time we started applying for jobs. So absolutely, not just for our portfolios, but also for our applications. These were some ace points that we scored, the brownie points that we had. As Atik said, quite nicely said that it will take hours and hours if we start discussing about how to do audit. There are a few very generic topics for performing audits, and these can be done anywhere. In your hospital setup, you can do it with your friends around multiple hospitals. And quite frankly, these are very small things which we just in our day-to-day practice change within months or weeks. If we find that something is not going right, we discuss with our clinical supervisors, our professors, our teammates, and change stuff. So instead of doing this verbally and in an informal way, you just put in a formal way. It can be as simple as gloving techniques. It can be as simple as your waste management in the hospital, taking lectures for students, how you can improve it, the feedback stuff. As I said, if you go into it, it's quite elaborate topic in itself. So these are some very small points that I can put into highlight, which will help you do it. And as I said, if needed, we can always put in another session wherein we can discuss if everyone is having the same problem.
Brilliant. So, Dr. Harshal, I really would like to see, and I would really love to see from you, both of you, and I hope like this will help immensely to all of our present candidates for tonight is about your CV and about your portfolio, how you have construct those, and what were the changes that you have made into your CVs so that it worked, right? It worked because as far as I know, like for the 2024 or 2025, the amount of post for the general surgeons was 143, if I'm not wrong. Okay, so among 143, getting both of you done, it is not a matter of joke. Yeah, directly from India to go into the training post within the 143 among the rest of the world is not a matter of joke. Yeah, so and I know like when you have passed, just last year you have passed that, right? So like that's where I'm so keen to show your CV and the portfolio why it is so important, why it is so special that the people who are hiring or recruiting for a training post or the jobs, they really like that, right? So I really want to see, and also I would like to show this to all of the candidates so that they will have the idea how they should construct their CV, how they should construct their portfolio. But one thing I want to mention, guys, suppose all of us, especially our subcontinent, like from Bangladesh, from Sri Lanka, from Pakistan, from Bangladesh, from India, we would like to copy and paste, right? We really like to copy and paste the same thing for my CVs and portfolios as well. And trust me, that will not work. Okay, trust me, that will not work at all. Okay, so you need to have the idea, you need to construct your own CV in your specification, and then you need to type it out with the amount, like a proper amount of time, and then you will have a special CV which can be popped out, and you can have the call for your job or for your training. Okay, you need to give some time, at least I would say maybe 4 to 4 hours, maybe a day to construct the CVs, right? In order to get it in the very first place for the like first 10 or 20 or 25, you will not get any call or anything, and you'll be frustrated, right? That's why you need to learn what are the things that you need to change. And I really hope, and I'm not going to talk that much because Dr. Harshal and Dr. Ashwarya, you guys will show, and please go into details. Okay, I'm going to leave my screen to you. Now, please share your screen and show us how you guys have done this miracle, please.
Very rightly said. Aishwarya is going to take over further, but very
Sure.
rightly said that yes, so copy pasting and then not getting jobs is quite frustrating. And I think I did it for first at least 50 applications. I was telling Atik sir yesterday about it. So yeah, I'm the live example of copy paste the same application, just work on one application first and then just keep on copy pasting, which did not work at all for me. So yes, you need to work on
Okay,
it, guys.
one thing that all the candidates must know one thing, that is for the jobs. I think Dr. Ashwarya, you can specify those things like the both of the things for the track and CVs and portfolios and the Oriel that you wanted to mention. Just clarify that in the very first place and then go for the details. Otherwise, they will get like some confusion for that.
Bit confusing otherwise. So I will be covering the first aspect, which is your main entry, which would be into the NHS, the non-training route. So there are two ways where you can actually even become a consultant here in UK. One is through the training, and the other is through the non-training route. Even if we enter on middle of the year, like how both Harshal and I did, we entered in and as a non-trainee. Yeah, and that's completely fine. It's okay to not start off as a training here. This is just a small slide to make you understand the difference between the trainee and non-training route. This is something that we had a huge confusion of even after we came here to UK. So I thought I'll just clarify that in the beginning itself. So the foundation year one is equivalent to an internship that most of us have after our MBBS. Over here, they do another year of foundation. That's foundation year two. And following that, training-wise, they have to apply for a core surgical training. And once they've applied for it, they get into course, that's CT1 or CT2. And CT1, CT2 is equivalent to an SHO grade here as a non-training. So if you're working here as an SHO, you would be given the same importance, or at least the same standards as a core training. And another name that they use in some of the applications, which can get confusing, is a junior clinical fellow or a trust grade doctor. Again, these are seen in the application. So just in case you get confused, I've just kept this slide here as well. Now, going from the core trainee, they can then further go on in training to a higher surgical training, which is what both Harshal and me have gotten into now. This higher surgical training includes a 6-year program, which is from ST3 to ST8. Following this, you will get your competencies signed off and you get the certificate of completion of training. That's the CCT. You can become a consultant post CCT once you've got all your competencies signed off. Now, similarly, this can be done through the non-training route, equivalent to the ST3 to ST8. That's 6 years of the higher surgical training. You have a non-trainee registrar post. So that can be said in the applications as a trust grade registrar or a senior clinical fellow. And one of the higher specialist or specialty trainees that they consider is usually what they say from ST6 to ST8 equivalent is a SAS doctor. So these are the non-trainee posts that are present, which can completely be done. You can work through these years as a non-trainee and get your competencies still signed off and get the certificate of eligibility for specialist registration. That's the CSER route, which is heard by few people. So if you complete your competencies and finish your CSER, you can also become a consultant. So you can take either of the two pathways to become a consultant here in UK. It also needs to be understood that from a non-trainee, you can enter the training route, which is exactly what the both of us have done. I first worked here as a senior house officer, in fact, and then worked as a registrar. Harshal has worked here as a registrar. And then, as you can see through the arrow mark, we have entered the specialist training by completing our Crest forms and doing our portfolios, which Harshal will give you a little more in detail about. So,
Dr. Ashwarya, can you just clarify these two things, like the Crest and the CREHST, these two forms, because I really think like they really want to know about this in a very short way, I guess.
it's very simple, actually. So the Crest form, if you notice, is the form that helps people join the core trainee surgery training. Sorry.
Yes.
So that would be people who have less than 18 months of surgical experience. So if you finished your master's in surgery in India or Bangladesh or Pakistan, then there wouldn't be much use in entering the core surgical training because you might have already finished this 18-month period, which makes you ineligible for it. So you would rather apply for the higher surgical training, for which you would require your CRE HST, HST being higher surgical training. That is the form that you need to get signed from your seniors, your consultants, whether you've worked in UK or from India. You can get it signed from them saying that you have the required competencies that to apply for the higher surgical training. Now, this can be done from either the junior clinical fellow or SHO job, or even as a registrar. Anyone who wants to enter the specialist training can get this form signed off.
So one thing, there is a special form for that, right? And there is an online version of that form which you can just simply download, and also you can print that, and you just cover it with all of your information, and then you just take the sign from your professors or the consultant under whom you are working for quite a few months. I think that should be at least 3.5 months that you have worked under one consultant or any other professors. They are eligible to give you the sign for this form. Yeah, if I'm not wrong.
I've linked the
Okay.
form if my presentations as well.
Yeah,
So
that's what I'm saying. Like just link the form into the in the session so that everyone can just simply download, I guess. Okay, so this will help. Maybe some of them are already past the MRCS and they are trying to get right. So suppose they're in India or in Pakistan and in Bangladesh, so they could have done that earlier before they went back to there in the UK. So this is, I think, much more easier for them to do that. All right, go ahead, Dr. Harshal. Please. Sorry to interrupt as well.
No, these are a very, very valid doubts, which even we had, so it's completely understandable. So these forms are important. It's better you get as much as you can done from your home countries before coming as well. We were lucky to have good guides from India who helped us through this even after we came. But yes, if you can get them signed off, it's much better. Coming to this non-training route, which I will be covering. Non-training is, as we've said, you can enter in as a junior clinical fellow or SHO, or you can enter in as a registrar as well. At first, I joined in as an SHO, and then I changed my job to a registrar post. So I've got a fair idea of how the application process works. To enter in, the first thing is to apply. So to apply, you go through the track jobs or the NHS jobs. It's very easily accessible. You can get them. You can even just Google them and they'll come. When you enter, you have to make your own accounts, and you've got the job search where you obviously are looking for a medical and dental aspect. Here you can look for the occupation you have in mind. There's different options such as breast surgery, just surgery, urology, or medical ITU. And you can look, if you're looking for a particular grade, then you can look for that. Just a small thing, at first, we were very particular about our grades, that we wanted only a registrar post. But then, I mean, it's okay to join in even as an SHO. I would say just look out for all of them if you're searching for a lot of jobs from the UK, especially in our case, because we were specific about being in the same region. And coming to region, you can also allocate the region of that you require. Once you've put that in, then comes the different applications. This is something that I would suggest you look into on a daily basis, because there are new jobs that pop out every day, and some of them, they get more than 200, 300 applications in a day. And if they get too many, they might just stop the application opening in a day itself. So if you really want to grab your opportunities, I would say to just go through it every day, especially if you're particular about your place, your subject, the surgery, whether you want to do surgery itself, urology, and obviously if there's a grade specification. Once you've chosen everything, you'll read through the application, make sure you go through every single point in the application. It is pretty long and it does take a good maybe 5 to 10 minutes, but yes, please go through each and everything, because there are some things that you also deserve to know, and there are some things that you should know that you need to emphasize on while you're giving your application information as well. There's the job overview and main duties, which is specific for you. You make sure that it's categorizing everything that you want to do as well. Make sure that it's got good opportunities for you with regards to research, if that's something you're interested in, or with regards to the theater slots, the clinics. These are all explained in detail during the job overview and main duties. Now, coming to the person specification, this is something they are looking for. They want you to advertise yourself based on the person specification. So make sure you go through each and every point with, whether it's the essential and the desirable. Obviously, essential is the most important thing for them. Having the desirable ones obviously gives you that upper hand though. So make sure you have each and every point listed out. Make a note of them if you have to, because while you're filling your application form, you need to make sure that you have each and every one of them ticked out. And you need to make sure that they know that you're the perfect candidate because you have all of these ticked off. And one specific thing that we realized was very helpful was looking at the consultant details, which is right at the bottom of the applications. This gives the consultant's name and their email address, and sometimes even their numbers. I wouldn't go and call them because that's a bit too forward, but I would suggest sending in an email once you've sent in your application, telling them that you're interested in so-and-so post and why they should consider your application in the first point. Because like I said, they have over 200, 300 candidates applications to look through. They're not going to waste too much time. It's going to be a very quick segregation process. So you need to make sure you're highlighted amongst everyone else. So through the application process, there are many aspects to it. Obviously, everyone will be able to fill in their degrees, their qualifications, and the details that they have regarding workshops and fellowships that they've done. What I've realized is, at least what I think is our limitation, is the way that we have to write about ourselves. In our countries, we're not very well versed with, as I say, advertising ourselves. We're more about sticking to the point and saying, okay, I've done so and so and so, I've done this conference, this paper, and I've done so many surgeries. Now, they don't want to know a lot about that. They want to know why you've done what you've done and how that is going to benefit them. So what you need to do is make sure you've expressed more of the buzzwords in your applications. Now, this is just one of the descriptions of the employment history that I've given over here. This is not an ideal answer. Let me just tell you. So even if you copy and paste this, this is going to be wrong. But there are some certain things that I would like to highlight through this to help you understand how to write it better.
Yes, so I really want to make sure, and please, everyone, whoever present and whoever is going to watch the recordings later on as well, keep this thing clear in your head, okay? Maybe you can take a screenshot right now or later on, right? But if you're going to repeat these things and put it into your CV, this will not work. Trust me, this will not work.
Yeah. This is from one of my applications which didn't go through. So if you want to copy it,
all right. That's a good move.
Yeah. So
All right.
yeah. So what the thing is, I feel that there's more to learn from failures than from successful stories. So this is a very good example, I would say, of where you can do better. So as you see, I've written a lot in this because I knew I had to write extra, and I'm from ICSE board where we're taught how to write too much, but this is not ideal. First of all, there are grammatical errors in this. And second of all, we tend to use our local languages such as OPDs, OTs, which is something that they don't understand over here. In NHS, we don't use OPD, we say clinics. We don't say OTs, we say theater. So there are these few things that you need to understand, that you can't use just the normal words that you used to. You need to understand that you need to use a more understandable vocabulary for them as well. The other thing I want to press on is using some buzzwords through your application, as I mentioned. So as I've highlighted, there are words such as improved patient care and recent publications. So these things would help them understand that, okay, this person is more interested in improvement of patient safety, patient management, and we need someone who's going to make NHS better. So this person could be a good asset to us. Having recent publications, mentioning that you are interested in incorporating recent publications and understanding these to improve the outcomes, patient outcomes, gives you bonus points. Obviously, you will mention about what all theatre exposure you have and what all teaching and research exposure you have. I would suggest to have this in a more systematic manner so that they can understand it better. I'm not too sure if everyone's heard of the CAMP protocol that's there. That's your clinical, academic, management, and personal. So if you put it in a more systematic manner, they can understand you better and understand which aspects of you have as a strength and which they can help you work on, because no one's perfect. They understand that. They need to know if they and the candidate can work well together. So as I said, I've written a lot of the things I've done in this. I mean, if I sent this to someone in India, I think they would be very impressed. But unfortunately, no one was impressed over here because it wasn't systematically written. It didn't have the right buzzwords that they required, and it was just information for them. This is just another one where I think I improved on a few things in this. I did mention a lot more about, as I've highlighted, multidisciplinary approaches, which is another buzzword. I've mentioned about audits, where I have considered these methods of improving patient management. So these are some things that have actually helped, but again, it's not as systematic as they would require to read it through. When I say advertise, I don't mean writing. I think there's a word limit to this, about 150 words, if I'm not wrong. So it doesn't mean you have to use, it doesn't mean you have to use words. You can have even 100 words, you can have even a 50-word essay written, but you just need the right words and the right systematic manner to mention and to explain how you are good. That's it. Because they have enough number of people telling them that they've got the theatre experience. They have enough number of people telling them that they work very hard and are dedicated and they're sincere, but they just want to know certain aspects that makes you more incorporated into the NHS system. So yeah, this is just another thing that I noticed over here, which helped. And coming to the teaching experience and the management experience that we have as a section in the application, what I realized much later on after getting a job, in fact, is there's a way to answer them as well. So your teaching experience isn't just formal teaching your undergraduate students classes or anything like that. That is considered as your formal teaching. But if you've completed your master's in any of your home countries, then you would have had regular training by your seniors, and you carry it forward. You regularly do your ward rounds, you teach your juniors during your ward rounds, you teach your juniors even during surgeries. All of this is considered as teaching experience. So make sure you mention them. Make sure you give the importance of every single thing you've done through your training. You tell them that if you've got formal teaching, such as teaching lectures, or how in our case, Harshal and I are both ATLS instructors. So we've mentioned how we've got formal training that way. I have come here and become a start course instructor as well. So that has added on for my formal teaching. Informally, you can go on. It just doesn't stop. Even this session could be a form of teaching. So even if you teach a few people, please mention it. Give importance to every single effort that you have put in to improve your career. Coming to the management experience as well, we had no clue what management meant, in fact, while putting in our application. It's only something that I got to understand more after coming here. Management and leadership is, again, it can be formal and informal, but understanding our grades of work, we're not going to be a head of the unit or head of department in our grades. So you can't, it's okay to not have everything, but you have worked with a team. You work with a team all the time. You manage emergency patients, you manage projects together. That itself is a management experience. If you've been a part of a conference committee or any committee as such, it is management experience. So make sure you highlight each and everything. Even if you've played a small role in it, you've still been a part of that team. So make sure that you explain all of that. Research and presentations, I think we've pretty much covered the fact that it is important. It's obviously better to have more of them. And especially if they're PubMed index journals with a good impact factor, they do give priority to those research
That's too
publications.
much. That's too much, Dr. Ashwarya. That is for the nerds.
Yeah, I know, I know, I know. And it's
Yeah,
completely all right. Exactly. It's completely all right to not have
yeah,
everything. Like I said, these
yeah.
are applications processes to enter these jobs. So they're not expecting you to have everything. They're expecting you to make sure that you have the essential criteria. The rest
Right.
is just you trying to
Supporting
advertise.
things. Yeah.
So even the presentations, your local regional presentations, even a normal presentation that you've had in your hospitals or in your colleges is good. And yeah, the national, international are just bonus points to that as well. So the last bit is the supporting information, which again is, I feel is, in fact, I think this is the most difficult part of the application because we don't
I
know how
agree.
much,
I agree
yeah,
because you will get very confused after like knowing the supporting information that you need to give, because there is a specific things for specific jobs and you need to make sure that it actually matches their requirements as a supporting letter, right? So it's a messed up thing. Yeah, clarify these things. Thank you so much for bringing this up.
yeah. So especially if you've mentioned a lot in your
Mm.
employment history, and they've mentioned here not to repeat that. So it does get confusing, and
Yeah,
I mean, it's completely understandable. I don't think any of us will be completely sure of how perfectly balanced we can make the application. But for the supporting information, I think the most important thing is to make sure you've highlighted the essential criteria. So again, this is not an ideal answer, but it has highlighted each point of the essential criteria that I wanted to highlight for this job post that I've applied for. So I made sure that I wrote down the essential criteria and the desirable criteria. And even if you notice in the person specification, they've already categorized them and put them in an order for you to answer. So you can use the same order and answer it in your supporting information. You can make sure that, so if they say that they need MBBS, MRCS, then fine. I've got that covered. So I've got all of this done. In inclusion to that, I've also got an added degree. You can add that. That's fine. That's good. It's a little extra. Maybe it's even more than the desirable, but at least it makes it clear to the consultants looking through your application that you do have a keen interest in improving yourself with degrees, which is always good. And then you talk about your experience. They have their research and presentations, which you can mention, and also they have the communication, which I think is an important aspect of the person specification. Communication, obviously, like we mentioned in the courses, if you have any of those courses that you can mention that, but if you don't, it's completely fine. You can just mention how you are considered a good orator. If you've done presentations, then that's proof enough that you're a good communicator. If you have teaching experience, then do you have feedback for this? Do you have feedback for any of your presentations? What's your feedback from your consultants? Do they think you're good? You can mention all of that as supporting information to help improve the outlook of how you are as a surgeon as well. Having your surgical skills is something that's very good, obviously. If you've done laparoscopic surgery or open surgery or whatever surgery you've done is a bonus. But just saying that you've done a surgery is not good enough for them. You need to mention if you've done a surgery with your senior, has it been supervised, unsupervised? Has the person with you been, who's supervising, been scrubbed, unscrubbed? So that gives you a bit of an edge over the other people.
Dr.
If you've
Ashpriya,
done
you can, Dr. Ashpriya, sorry to interrupt, but you can mention the competency score that is mentioned, whether you have done this independently. There is a score. If your like your senior was with you, there is another score, and if you have the top one is, as far as I know, like if you can manage the complications, right? That will have the manage the complications independently, so that will have the higher score system. So you can mention as those things as well.
Yes. So actually there's a portfolio that we have over here called the ISCP portfolio, where we put in our details for each of the cases that we've done. We mention procedures, we mention how well we've done them, and were we able to manage complications? Were we able to manage the surgery itself on our own? Was the senior scrubbed, unscrubbed? We also have an e-logbook to replicate this information. And in that, there is a section that mentions at what level that you've completed the procedure. So it can be just assisting, it can be doing some parts of the surgery and the rest of it by your senior. It can be doing the surgery along with your senior present scrubbed. It can be doing the surgeries with your senior present in theater but unscrubbed, and it can be just completely unsupervised. So with this, it's graded from 1 to 5, basically. 4A, 4B is when you're able to do it completely independently. 5 is when it's with your complications tackled. But I don't think they expect you to know the numbers per se, even if you can just mention that you've done it with a senior unscrubbed, you've been able to do open hernia, inguinal hernia surgeries with independently without the senior, any senior supervision. That gives you a bit of an edge as well, because they know that you understand what they expect as well. So it gives you obviously some brownie points for that as well. Also, I think this is just something I personally felt was important to highlight, is it's okay to have your limitations. I applied, as you can see, for a renal transplant job when I didn't have any experience in renal transplant. So I have mentioned that it is a limitation that I've not done it, but I have also mentioned a solution to it by telling them that I'm known to work extra. I've understood the NHS and I understand how to improve myself, and I will use this as a good opportunity to improve on renal transplant and vascular access. The fact that you're an IMG, coming to a new country itself shows that you're adaptable. The fact that you're leaving your home countries, coming to a completely new, estranged place, and working with unknown people in a very new environment gives you that upper hand. So that's something to advertise as well. You can mention that you are willing to do this. You are so adaptable that you can come to a new place and work. So these are the things that you need to make sure that you talk more good about yourself in that way. It's okay to have something low, but tell them that you're willing to work on it. That's all they need to hear. And yeah. So once you've done with your application, in Track, they have this very good system where they save it. And they also have a very bad system where you can just copy it to your next application. This is something that many people do, and trust me, they repent it. It's okay to copy application information from one to another.
Some point, right? Some point will not change, like your academics, about your personal, personal informations and all that stuff. That you can copy and paste. That's completely fine, because both those will not change. Yeah.
Yeah, exactly. So I would suggest you can copy paste it from your previous application, but please go through it in detail, like every single word. Make sure you've made the required changes so that it mirrors what you are at that point. Again, they're going through more than 200, sometimes even 500 applications. They're not going to sit and look through someone who's applied for, say, a renal transplant job where they've mentioned, I'm interested in upper GI colorectal. Don't waste their time. It's just going to get them more annoyed and lesser chances of you getting things. So try to make the best use of each application, and trust me, there will be openings. People are very, at the end of the day, they do want IMGs. They know that they work well. They know that they're a good asset. So if you can just show them why you're the good asset, that's good enough for them to take you in. So once you've done the application and you've submitted it, then you get shortlisted for interviews if required. And in the interviews, just briefly going through it, there's usually a management scenario, clinical scenario. Management scenario is more about how you deal with, say, a colleague, a difficult colleague, or a difficult senior, or a junior colleague, and how you would tackle the situation. There's no right or wrong answer in that. It's just about how you can be patient and manage and be kind-hearted, rather. Clinical scenario is more about the application of the Crest protocol and making sure that you understand what's important in an emergency scenario for managing a patient. They also usually ask a quick question about yourself and why you should be considered for the job. Again, advertise yourself. Every single thing you have done through your years of even MBBS, and if you've done your master's, then that. Every single thing you've done needs to be highlighted. Make sure they understand that you are the best. And sometimes I've noticed that there are I've had personally few interviews where I had to make a presentation as well. So you still highlight the same things. Make sure they understand that you're confident. Make sure you practice 100 times if you have to. We used to practice with each other, practice with even your parents, practice with an unknown person just to understand how you are with communication. And yeah, once you've done the practice, I'm sure even the interviews can go well. Yes. Now,
Brilliant.
I think,
Brilliant,
yeah.
Dr. Ashbury. You have said a lots of things that was even unknown for me as well, right? So I'm really hope like whoever is present, they are getting a lots of information. I'm really sure that whenever I'm going to upload this, the recordings, they're gonna go back and they're gonna rewatch and rewrite everything for tonight's session. I'm really impressed that whatever you have prepared and whatever you have mentioned very nicely. Thank you so much. Okay, about the portfolio and the Oriel, it's basically for the training post, if I'm not wrong, yeah?
Yes.
Okay, so I think Dr. Harshal, you can take over for this one as well. Though both
Yeah.
of you have secured the training post, but like as Dr. Ashwarya said about that, so I would like to mention that you guys, Dr. Harshal, can you please put some insights on that?
Sure. So we're just going to come to a part now. Aishwarya has spoken a lot about how to do a non-training post-job
Mm.
application, how you enter into the NHS. One thing to understand is all these job posts, if not advertised as fellowship programs, are actually just jobs. You need to understand. So I'll tell about myself. I don't want to say that anyone else is confused or not, but I was confused when I was applying for jobs in UK in NHS. I was thinking that I'm going to get into a fellowship program. I in fact chose a hospital which is the best center, I would say, for colorectal surgery. That's St. Mark's Hospital in UK, and my hospital was attached to it. So I thought that might be the best hospital, and I'll be getting into fellowship. But at the end of the day, if it is not advertised as a fellowship program, you're just coming for a job in NHS. Be sure about it. All you're going to gain is experience. You might be doing some surgeries. You might be doing clinical, as in managing clinically patients. That's it. Rest of it is all the onus is on you. Whether you want to do presentations, you want to do audits, you want to do publications, no one is going to push for it. No one is going to ask you to do it. It has to come in within from you. The fire has to be within you. So that's about the job applications. I wanted to specifically highlight it because I was confused. I was thinking that I'm getting into some very fancy place wherein I'll get to do. I was
Even
all.
me, Dr. Harshal, when I was just doing, sometime I applied for that and I was like, fellowship. Okay, that means I'm gonna get a fellowship and all that stuff, right? So, and then I thought like, when I go for the details of the description, so they said like, this is not about the fellowship that you're going to have, but you're going to have some trainings, right? The training will be count and all that stuff. Like, okay, let's not do it.
So it was a major, I would say, entering into the system initial few weeks and months was actually
Hmm.
a big sort of a downgrade, if I would say, in my clinical practice, thinking that I was expecting a lot. But
Hmm.
that being said, once they see you, they assess you, you are a safe surgeon, you are a good surgeon, your skill sets is good, they eventually progress you. As in the progress that I've had in within a year, I'm getting to do complex cases as well with support from my consultants. So they
One
do
question.
assess.
So
Yeah.
sorry to interrupt you once again, Dr. Harshal and Dr. Ashwarya, both of you. So the thing is, in back of like in our medical school, or maybe even after the medical school, we heard like, okay, if you're going to go to the UK, then you're not going to get any patient to do your surgery because they are going to do that, and you will be only the assistant. Is that correct? And is that true? Because both of you have done the SHO jobs, the register jobs, and now you're in the training, right? So clarify that in the very first place. Are all the IMGs will have the access to do the surgeries by themselves or not? Yes or no?
They will get to do
Okay,
surgery.
perfect. Okay, all right.
Depends what you're expecting. As in, I'm doing complex cases as well, which I was doing back in India.
Hmm,
So
hmm,
it depends on your appetite, your hunger. But
hmm.
whatever you want to do, if you do it good, safely, in a skillful manner, without jeopardizing the life of the patient and the surgery, you'll get to do it. Don't worry. Hands-on is there in UK. Yeah.
Hmm.
I think it's more about, I think it's the same everywhere.
Yeah,
Even in your hospital in your home country, no one's going to give you an appendix on the first day. They're going to make sure
exactly.
that they
Yeah.
make sure that you have the surgical skills. So it's the same over here. They're going to take some time, make sure that you're actually trustworthy with patients, make sure you know some clinical management before they
Hmm.
Mm.
allow you to touch patients, and make sure they know how that you can handle some of the basic complications and acutely unwell patients, like we mentioned. So if you can
Right.
do all of that and you gain their trust, they'll be more than happy to make sure that you get your chances as well.
Yeah. So one very valuable questions asked, and we got the answers. Very, very good. Okay, move on.
Right, all right. Before I start the portfolio and the Oriel applications, and we are going to dive into how to get a training post in UK, I would like to tell that I come from a system wherein every time you want to upgrade yourself or get into a training program, we are used to giving exams.
Hmm.
The system is give exams, study for a year, that's it. And you get a good rank, you get in a good program, then again, do your way around through the training program, become a consultant. That's not how UK works. UK is a very tick box and check box related system wherein you need to have a overall growth in your personality, in your career, in your skills, and not just a single aspect wherein you sit and study for 18 subjects and you know all the books by heart, you know pages through, and you know what's the drug of choice, what's the best management possible, what's the next investigation in the way. But the training process in UK is very different. They want candidates who are not too experienced in in a specialty. At the same time, they want someone who can be trained. At the same time, they also look for people who have a career aspect, or they feel that they should progress in this career in a certain way. So they look at your personal development program. What is your plans, personal development plan, sorry. What is your plan in future? What all you want to take into consideration, your academics, whether you want to do time out from your training, do a PhD, you want to take time out from your training, do some other specialty job, or like I have some colleagues of mine who are in training who are doing colorectal surgery, but they are doing PhD topics in gastroenterology, that is medical gastroenterology. So they look at candidates who have thought process in this way and not a very focused mindset that okay, I get into this program, I study for it, I become a consultant, that's it. No, they don't want someone who is just doing surgeries, who is just doing academics. They want a overall grown person. So this is the aspect that I liked about the UK system, that even if you are a football player, they'll push you. to become a very good football player while you become a good surgeon. It's not like you leave your football, you leave your music career, you leave everything else and just focus on surgery. No. That's the beauty of the system, I would say. And that is what is going to be highlighted further as well as I talk about the portfolio. So as I said, portfolio, what and why? So it's basically the experience and skill that you've acquired through various postings after your graduation. So you've done your MBBS, you've done your F1, F2 jobs, that is internship year one, and internship year two, that is the F1, F2 equivalent, as Aishwarya said. So it can be various postings, as I said. It can be emergency medicine, it can be your ITU, it can be surgery, it can be urology, various aspects. It doesn't have to be just general surgery. It, as I said, it has to highlight your dedication for the craft and specialty and not just see you as a candidate who can sit for 15 hours altogether in a day with 2 meals a day and study whole day long. No. This is specific, the third point, student slash doctor. They're not looking for a very good student. They're looking for a very good doctor or a doctor who can be trained. They're not looking at you as a student. So once you've done your MBBS, they look at you as a doctor and you have to excel that way. It is an objective assessment criteria. So they have tick boxes, as I said. If you fit in that, you go through. If you don't fit in that, you're chucked out. So NHS track jobs is one side that you should be aware about. Then Oriel is the other side that you should be aware about. ORIEL. Search on Google, you'll get it. So this is my Oriel page. If I can take you through, it's basically a very simple page which has a dashboard, which has documents to be uploaded. This is what starts when you apply for any specialty training in UK. This is for surgical specialties. As you can see, if you see on the right hand side, there's plastic surgery, there's urology, and general surgery. We're going to put a focus on the general surgery. Don't worry, the highlights, the details that I have hidden are just my personal informations and application numbers. Apart from that, you can very well see I applied for plastic surgery, did not put through any, because every application process has different aspects of the application process that you should be putting in. So plastic surgery, for example, needs you to do eschorotomies. You need to do certain procedures, which I did not have. I applied for it, but did not submit any papers to support it. Straight away rejected. Urology fell short of some processes, rejected. General surgery, I was trained in general surgery, hence I had most of the details that they required, hence I got into it. Okay. So for general surgery, there are 7 questions. As I said, it is a very clear system. It's black and white. There's no gray areas. There are a certain number of questions you need to go through. If that goes through, you're getting your shortlisting. If it does not go through, you're not getting shortlisted. So just an overview of questions. We'll go into the depth of them. Don't worry. Number of years in general surgery, highly, highly important. If too less, takes away points. If too high, takes away your points. At least 4 months on any subspecialty surgical branch. As I said, they don't look at you as just a general surgeon. You need to have any other aspects to your play as well. Number of appendectomies completed. This is a very important surgical skill that they look for. Appendectomies is what they want. 2 best publications, PubMed, peer reviewed. There was a very good learning point that we said during not having any peer reviewed or PubMed publications. Actually, that is a very good point. If you write in your personal applications, as in the personal information, that I am someone who recognizes that I don't have many publications to my name. But at the same time, I'm someone who's very keen to learn about how to do a research, how to do publications. If given an opportunity and with support, I would want to pursue these aspects and want to fulfill these aspects of my life, which I'm lacking in. This shines you as a candidate who does not think that he is a uh, very overly confident candidate and is being negligible or oblivious to the fact that he lacks in something. So this is something that I would want you to think about as well in case. So put in negative points as well. It comes to your play at times. 2 best academic presentations. You will come to that and you need to do that anyhow. 2 best closed loop audits and QIPs, as we said, getting into it will be a very big detailed session in itself. But yes, that these 7 points are must points for any training application. So these points have to be there. So 2 best closed loop audits, when I say, if you have 2, good, you get all the points. If you have 1, you get half the points. If you have none, you get no points. Straight as that. Any standalone degree, that's basically if you've gotten any degrees to yourself. Any foreign degrees are recognized as well, but there is a process which I'll come back to. Okay, so long listing. Long listing is the process that we discussed about, wherein initially you put in an application through the Oriel. They say that, okay, this year's training program applications we are opening in the month of October. You put in your applications. For long listing, you need to be MBBS qualified. You should have done MRCS Part A and Part B by the time that they have given. There is a usually there is a timeline by August. You're starting your career in ST3 training, or in October. So uh, I would not tell you what is the exact timeline, because it that kind of shifts every year. But there is a timeline by this time you should have completed your MRCS Part B. So you put in your MRCS Part A completion certificate, or and then they take into consideration that you will have booked your MRCS Part B and completed it by then. Complete employment history. mm, be very careful about this. Make sure that all the people that you've worked with have had good relationships with you and will be happy to sign you off. They just get an email after you put in your employment history that so and so person has said that he has worked with you from this date to this date, and do you recognize that? They have a very simple basic drop down list, yes and no, and it comes through to the Oriel. Why I said be careful is, if you have taken any gaps, be completely honest about it. Do not lie about any gaps that you have taken. They're not worried about your gaps. They're not worried about whether you've done anything else, whether you've done any family business, you've gone for a trip, you've taken a sabbatical or something. They're not worried about it. They see whether you are an honest candidate who's not lying about anything in their application. Mind you, everyone in the application process is considered to be honest and is saying truth. But if they find any one of the discrepancies in your application, everything else is scrutinized. Every point and every aspect, be it very small, they will question whether even you are a MBBS graduate. So make sure that you don't lie about any aspect in your application. And as I said, evidence of achievement of CT1 competencies for someone who's doing a non-trust grade job, non-training job, that's a trust grade job, and has not gone through the left side of the pathway that Aishwarya said, then this is for you. As I said, I will also highlight what is a Crest form. So certificate of readiness to enter higher surgical training. This is the form. Let me put it for you. So this is the form that comes in. Sorry?
I don't think.
Oh, okay. Can you guys see this form still?
No, no, no.
Okay, just a second. Yep. Just let me just put this on for the screen.
You need to stop sharing and then start sharing for your Microsoft Word. Yeah, perfect.
Cool. So, certificate of readiness to enter higher surgical training. This is the form, easily available on internet. We'll put in a link in the comments as well. Don't worry about it. Basic stuff. These are the instructions that you can go through later on. As Dr. Atik said, this will be your name, your GMC number, email address, stuff. Then this comes in. Now, applicant name, your consultant has to sign in, put in a signature, and the points that need to be ticked are pretty much very basic. So can you do a good history taking, clinical examination skills? Can you make a good diagnosis, safe prescribing? Again, they work through various aspects. So one is clinical care, second is communication, teaching and training. Are you someone who keeps themselves up to date? That involves auditing. Obviously, if you've done any presentations, publications, that comes in this as well. Leadership, team working, quality improvement. So these are the usual tick boxes that your consultant has to make. Okay. I will not put completely into each individual points, but you can get this through the link that we'll be sharing. You have something to add?
Yeah, just one thing about the Crest form, which is something that I felt was something I needed I had a difficulty with. There's a point 8 which says NHS management, where it mentions that you need to understand the structure of the NHS and the local healthcare system. When it comes to this, obviously, my consultants from India could not obviously tick that part. So this is where I feel maybe a job in the UK would give you a better insight, and obviously this will get ticked off as well for that. If you've worked here in the UK for at least 3 months, then the consultant you've worked with can tick this Crest form for you, and it can be accepted. It's important also because your uh, for your application to even be long listed, you need to have every single aspect of this ticked as demonstrates. There cannot be even a single one that says does not demonstrate or cannot comment. And that being said, if you have 2 or 3 consultants ticking or filling in the Crest form for you, if overall all of them are ticked as demonstrates, that's fine. So if one consultant says you can't demonstrate the NHS, but the other consultant says you can demonstrate the NHS experience, then that still is counted. So I think that's one important thing that at least I found important while I was doing my application.
Yeah, that's actually very correct. And hence it matters what job you're doing initially in NHS. So if you're doing something which is a non-clinical job, then the consultants who are working with you, although you do some on-call cover with the non-clinical job, but some consultants might actually come back saying that, oh, we've not seen you working in a hospital setup. All you've done is a lab job. So we can't sign this for you. So once you start working in NHS, I would say that what you can take up is doing locum shifts in your hospital itself so that you have some clinical experience. That's pretty much it that you should be knowing about the Crest form. Let's get back to the other aspects that we were saying. So yeah, back to PowerPoint. So this is the long listing that we were talking about. So Crest form we've talked about. So this is the initial bit that you submit on the application for Oriel. And this is usually a 3-month long process. 3-month long process? Yeah, almost like 6 to 8 weeks. And after that, you get shortlisted for your specialties that you've chosen. Now, coming to the questions, as I said, general surgical experience after foundation program, that's after your internship. So that's for maximum points for 25 to 36 months. And that's the 6 points that you score. Anything below that decreases points. Anything above this decreases points. Anything below that just says that you are quite early on in your career and then you can take some time to apply maybe next year or something like that. Anything above that says that you're very overqualified and you go towards a point wherein you are less likely to be trained properly. There'll be a lot of unlearning involved. So they wouldn't want you to be a candidate who's a training candidate, basically someone who's reaching level towards the consultancy phase. So they won't want to train someone like that. So this red point or the pink point that has come up now that I wanted to highlight is the responsibility for providing adequate, clear, and unequivocal evidence lies with the applicant. Again, they're saying very clearly that whatever you're saying is your own responsibility. If anything comes up, I'll tell you what are the repercussions that can happen because we've seen a lot of candidates this year who have lost their applications, sadly. Second question is subspecialty experience. As I said, they want to see that you're not someone who's just done general surgery, but also someone who has done different kind of allied specialties. Anything from trauma, orthopedics, plastic surgery, neurosurgery, ENT surgery, cardiothoracics, A&E, ITU. So not just surgical, even non-surgical aspects of it like ITU and E&E are considered in this subspecialty experience. So if you've got that, it's again good points for you. It's not just that one subspecialty program. If you do 2 posts, it increases your chances much further. So you aim to score 4 points in this. Next is number of appendectomies. This is something that you need to understand quite early on if you want to come into a training program in here, because unless and until you've done appendectomies in your home country, no one is going to give you appendectomies by themselves or hold your hand and teach you unless until you show those you show that enthusiasm from your side. You're willing to wait extra hours after the work and do it by yourself. So in that case, but I would say that at least know the basics, do some bit in your home country, and then come on to NHS, wherein then you can take it further from there. As we discussed about various points of surgical experience that you
Grades.
have.
Mm.
Yeah, great. So this is STS, that is the trainer, surgical trainer was scrubbed, or STU, that the surgical trainer was unscrubbed. So STS or STU, P is performed by yourself, or T is trained someone else. So if you have any of these, they can be considered as number of appendectomies that you've done. Uh, then again, you get penalized for having a lot more numbers. This was last year, I think this was these numbers were not this high, but slowly and eventually they started understanding that the numbers, because the numbers are being kept quite low, people are choosing not to do appendectomies or not show in their numbers, which was again, they didn't want any falsified information. They want people to keep on continuing surgical practice. So they've increased this number to more than 80, which is a very good thing now. So you can continue to do appendectomies and apply, even if you don't get this year, suppose you have this year, you've got 35 appendectomies, and now suddenly you don't get in this year, and by next year you have 60 appendectomies, say, which is, you were getting penalized for that last time. Now at least you can apply twice or thrice without getting worried about the number of appendectomies that you've done. Question 4 and 5, again, very important. Two best publications, two best academic presentations. I would say publications, as we said, we can discuss about it later on, but try and put in your head with centers. There are always some center of excellences where people are doing publications quite often. Try and go and talk with the professors there, the trainees over there, or the head of the departments in there. Ask them if you have any opportunities. Be the third author, be the fourth author, be the sixth author. At least get an idea about how the publication has to be done. Get your name somewhere in those publications, because it's going to help. Obviously, there are points whether you are the first author, you are the corresponding author, or you're the last author. You might get less points in that, but it's better than not having anything. So that is one of the things that you can take up, like speak to people in the center of excellences who are doing publications, and go and speak to them and get your name somewhere at least, and help them at least with basic analysis, Excel points, collecting data. And you can always put in your application that I've done so and so publications in, or doing so and so publications wherein I am helping get patient data gathering, analysis of data, sorting out in Excel sheets, which makes them understand that you know what publications are, researches are. Academic presentations, as I said, important. It doesn't matter whether it is a national, international, or a local level presentation. Obviously, again, everything gets points according to the level of publication or presentation that is. International gets the best points, then is the national ones, and then is the local ones. But better something than nothing. So even if it is a local presentation, you've presented in one of your teaching activities, you've presented in one of your state activities or something like that, do put it on, because it gives you points, definitely. The most dreadful point, audits and QIPs. Okay, we can teach you how to do audits. We can tell you how to do a QIP. As in, we would be more than happy to give you some basic generic audit topics that you can go through. Whether it will be considered for the applications or not, that's I would say that is the only gray zone in this whole process. They might consider, they may not consider. Thankfully, we had a very supportive team who allowed us to get into audits quite soon, because they knew that we are someone who are quite keen to get into training. So we got hold of audit projects and QIP quite early on in our NHS journey. So we had no ideas about audits and QIPs, to be frank, when before starting the application process from India, when we decided to get into NHS. We knew it because we were trained in general surgery. We knew the theoretical aspect of it, but hospital setup was not something that pushed to do audits and QIPs, especially in a government setup. I think the DNB centers do that, but not the government centers, at least. We did try doing it, since we had idea, we did try doing it initially. We did manage to do one or two presentations, but thankfully we had audits done in this NHS system. Yeah, put it, I've known some candidates who have gotten their audit certified from their home countries and gotten recognized. Maybe they don't get enough points as much as they would, but it's worth trying. Point is to get on to doing audits as soon as possible, rather than wait until you get into NHS and then wait another year if you don't get into your process quite soon enough.
If you don't mind me just adding to the audits, I think this is the most important, like he said, the most important aspect of the entire thing, because this gives you the maximum score. So I know it's something that we don't know much about, but if everyone can just put in a little effort to understand it and do it, it's very simple to get done. You can get them done even in a few months. And if you just get 2 closed loops and 1 QIP or 1 audit, open loop audit, then you've got 21 points in comparison to just 4, 6 or something else in all the others. So even if you have a lot of general surgery experience and you're going down in points there, you can make up with the points in this aspect. This is something that's easily you can grab.
Doable, yes. So yeah, this carries the most chunk of the point system that we will come to. Then we came to standalone degrees. If you've gotten training in your home country, obviously you can put in a point. We did put in a point for masters with thesis and dissertation. Again, disclaimer, not all the degrees are recognized in UK, so they say that you can do a UK NARIC. You can search on Google. This is a body which recognizes, which actually compares the process in different countries with the UK degree system and gives a competency of the degree. You get a formal certificate. We did it or not? Yes, we did it. Helps or not? I am not completely sure about it, because by the time we had applied, the UK NARIC was delayed for us. Although we put in saying that we have applied for it. So maybe it helps, maybe it does not, but it's always wise to do it early on rather than wait later on. So it recognizes officially, that's what they say, but final decision is with the selection leads who will be doing the scrutiny of your application. So not just masters with thesis and dissertation, you can try something like PG certificate. These are online courses if you can do it.
By the RCS England.
Yes, exactly. So these are quite good. So you can do it. Gets you 1 point at least. All right. After this, after you put in these, so up till now, these were the points that you
One
had.
question, Dr. Harshal, like about the diploma and the masters, will that include the MRCS as well as being the diploma?
No. That doesn't
Any
come
other things
into.
rather than the MRCS, yeah?
It does not. It does not,
Okay.
sadly. Yes, after this long listing process, as I said, until now was a long listing process wherein you've just put in your application. They will look through your MRCS degree, they'll look through your personal details, your previous employment history, whether you've gotten your CRE, HST form signed, and whether you're competent enough. Once that's done, you come to the shortlisting process. So that comes whether you will be shortlisted for the interview stage or not comes on to the fact that how many candidates did apply for this year. Individual scores of candidates out of 120. This year the highest score was 120 and we got graded 120, right?
Yeah, this year was.
Yeah, it was 120. So we have gotten our scores out of 120. The cutoff rates are quite dynamic. The usual cutoff rates are almost around 75 to 80 out of 120. That comes to 65, 70%. But always make a point that you score points well enough that you go beyond 80 and 90s. Once you're out beyond 90, sure, you're going to get an interview call. But you don't want to lie in a dilemma wherein you'll get an interview call or not. It becomes quite stressful, guys. It was quite stressful for us as well, the whole process. So instead of being that in or out kind of situation, get your scores sorted early on, because you saw all the points. They're quite doable, and everything is, as I said, objective. If you have it, you have it. You get the points. If you don't, you don't. That's it. If there is incomplete evidence, as I said, I don't want you guys to suffer through it. It's a major trauma. I've seen very good candidates this year in my hospital, in my trust, as well as around places, who were plain bluntly rejected applications because they did not put in evidences properly. So when they've asked you that whether you've done an international presentation, they've asked clearly submit evidence of your presentation. That can be your presentation itself, your certificate. It's not like you've done this, shown the certificate, got it. No, they want more evidence. If you're done teaching, if you're done audits, they want the whole audit um, PowerPoint presentation, whether it was seen, if it's gotten any feedbacks and stuff. So all these evidences have to be uploaded for supporting that. So if you've done an international presentation, just putting in a certificate was not enough. You had to put in the slides that you put in, or the poster that you've presented. All these things had to be put in together.
Also, your name in the
Yes.
program.
Yeah. So they usually, whenever you have these presentations outside, you have a program schedule of it. So they wanted that to highlight your name and make sure that you're not submitting any washed up evidence or something like that. Yeah, if you fail to do that, you will be plain bluntly said that you are not applicable to get into the training program. Your overall score will be 0. Doesn't matter whether it was just one section. The whole process is given as 0 points out of 120. It's very disheartening. It's I would say people feel uh, quite hurted by this whole process, but I think that's something that they've taken up quite seriously because they were getting evidences, they were getting applications without proper evidences. Uh, this then goes into the interview process after the shortlisting stage, if you've gotten your enough points. And then you come to interview stage. You again are assessed in 3 domains. Interview stage preparation and everything is completely different. You don't have to worry about this at the moment, I would say. Obviously, if you need any help, we will provide you with that. But this is something that you don't need to focus upon. The rest of the bits is quite challenging in itself, which you need to tackle on first. And once you get an interview stage, we would be very much happy because we've been helped by multiple people around UK, and we would be happy to help you guys as well. You can drop a message to Atik sir or us anytime, but I'll just tell you what the interview stage is. You assist in 3 domains. One is clinical station, where they'll give you a clinical scenario, trauma, surgical, any emergency in surgery, any theater case, something like that. In management station, it's same as what you get in your non-training jobs. You'll be given a difficult colleague. You'll be given some problem with your rota manager, something like that. These scenarios are multiple kind of things. Then you get your portfolio station, wherein they elaboratively ask you about the things that you've put in your application before, making sure that you've put it in by yourself and not forged anything or fake documents or anything like that. Everything matches clearly with whatever you submitted. They look for your leadership experience. This year they looked for a leadership experience and teaching experience specifically. Sorry.
Yeah.
Yeah. So these things they want to test for in the interview stage, for sure. Okay, after you qualify and gone through the whole turmoil and the stress, yeah, thank you for sitting along this. We come to the last part. After you qualify, you get to choose your deanery, you get your allotment as per your rank and preferences, and it's a 6 years long program. So this is what it looks like. I applied first, got longlisted, then you get shortlisted, then you get the interview call, and then you get the offer. I chose my deanery that was East of England. That's why you can see the East of England. It's an ST3 training program. This is the Oriel update that you get. You're always looking for that last green tick with the completed status. Yeah, that's the whole process. London is very small place, that number one that you see there, but the UK in itself is a very big place with lots and lots of deaneries. So these are just a highlight of deaneries that you have. We are at in here, which is numbered as number 13. So one is deanery of London where we are working at the moment. Then it goes around. This is not these numberings are not specific to the gradings of the deaneries. These are just random numbers. I've taken this picture for I think it was number of cases coming in from some places, some cancer cases. So, but this highlights deaneries. So it's a vast country and a deanery. So if you get placed in deanery, say number five, that's Scotland. It's a very big place. You can be at the tip northwards until the south end, or towards the east until the west end. So we chose our deanery, keeping in thinking thought process that what we want to do specialization in, which would be the best place for us together to go at, multiple aspects, personal and professional. So that's why we are in at here somewhere in number 13. But as you can see, it's a vast process. It's a very big deaneries system as well. So deanery is something, it's a big sect of land which has multiple NHS trusts. When you're putting in your training job application, non-training job applications, you're looking at trusts. So there might be a London Northwest Trust, there might be Barts Health Trust, there might be Southend Tyne and something like that. So these are trusts which are like DGH, District General Hospital, in them. So a trust has multiple level of hospital systems in it, and a deanery has multiple trust in it. So you start from a DGH, then
Teaching.
DGH and teaching hospital, then it comes to a trust, then multiple trust form a deanery, and then the whole complete all of these deaneries will form the whole NHS system. Correct me if I'm wrong.
Yeah, I mean, not all trusts can come together in one deanery, but they can be basically a deanery comprises of different hospitals from different trusts.
Yeah.
Yeah.
That's pretty much it. Obviously, this is the last process of it, but
Yeah,
yeah,
we can go
I
for
think we've
questions.
covered everything, isn't it, Dr. Atik?
Yes, I think you have covered lots of things, but that was brilliant. Like I was being like, stuck after all of this information because I don't have that much information about the training post and all that stuff, right? So it was like, it blown my mind as well. So yeah, it was a lot to take in as well because you need to give
Yeah,
some time in order to process those things, right? So I hope
true
like,
that.
all of this information is so important to all of the candidates, right? Because there is a certain problems now we are facing that people are like, not that much keen to go for the MRCS and all that stuff because the number of jobs has been reduced or the amount of degrees has been reached in a like at the optimum level that people are not getting the jobs. That's like no problem. So people are thinking maybe, okay, after the MRCS, am I getting a job there or not? Right? That's a burning question. So you both tell me the questions answer. Maybe that is the first questions all of the candidates is having right now after passing this MRCS, whether I'm going to get any job in the UK or not in a current situation. Clarify that thing in the very first place.
It I would start saying that it was the same last year when I applied for jobs. I
Hmm,
still remember. I think I applied for almost 84 jobs,
hmm,
and I'll start by saying that I was a fool when I was applying initially. I applied for 50 jobs without even realizing that I was applying it in the wrong way. I started in the month of October. I always tell people about it. Month of October, I think I got one interview call which was scheduled in February, and until December, I was putting in applications, copy paste. I had just made a format. I had my CV in place. Everything was copy paste. Personal information, copy paste. What supporting information is completely copy paste. I was not looking at person specifications. I was not looking at what the job profile is. I was not looking at the essential criteria, desirable criteria, nothing. It
hmm,
was not until some 12th of 13th of January when my head suddenly popped up once, one fine night. I was like, I'm doing something wrong. I don't understand why I'm not getting any interview calls apart from that one place, which I don't know how it chose me. Maybe I went, I must have fulfilled some criteria by fluke. And then I started doing my applications job specific. And that's when all of a sudden I had multiple interviews. I had 3 or 4 interviews just in a span of 15 days because I was fulfilling every question that they were asking. I was not putting any nonsensical information. The time was such that no one was getting any jobs, not even interviews back then, or else they were getting interviews, but they were not being selected. So it was almost same. Maybe it has now become a bit worse, if not better, but it is not completely impossible. Before applying for the training post as well, we were told that, oh, just apply it off this year. You'll get to see how the process is, and you'll at least understand this year. Less chances that you'll get into. I was told by consultants as well. Less chances that you'll get into the training program this year, but at least you'll know how the system works, and next year you'll be better prepared. Uh, so I would say that every time you will be told about these facts where NHS is a very botched up system, you're not getting any jobs, they're looking at different aspects, doctors are not being favored or something like that. You should understand one thing about UK. Everything that happens, even in the nooks and crevices, is highlighted, is projected, and it's shown everywhere. So in say in my hospital, if there were just three jobs and there were 27 candidates who were competing for it, it wouldn't be highlighted. I'm talking about just about my hospital in India. It wouldn't be highlighted. It will be just in amongst the students who are applying or the candidates who are applying. In NHS, they do get 500 to 600 applications for a single post or maybe two posts. But then again, you have to understand that there are people from all over the world who are trying to get into NHS. In India, in my hospital, just in one hospital for three posts, there are 27 candidates. So obviously, the UK NHS, they highlight everything. In every group, you'll go and see there'll be people saying, "Oh, I don't like NHS. Oh, I don't want to come into the system. I'm applying for 2 years and 3 years." If someone is applying for 3 years and not getting a job, if someone is applying for 2 years and not getting a job,
Yes.
That means
there's
there is a
something
problem in the application.
Yeah.
definitely wrong that they're not doing. And
Yeah,
and
yeah.
if you understand within 6 months that you're not getting a job,
Yeah.
that means you need to, as we've gone in depth in whole portfolio system, you need to understand that you need something extra and something special that you need to do. Maybe you're not done enough courses, maybe you don't project yourself properly. Take in those extra sessions for communication, take in those oration speaking classes, try teaching students, make yourself better presentable. uh, I've heard that some candidates, in fact, come for interviews if they get interview calls in t-shirt and
Yeah.
tops and something like that, which is completely unprofessional. And then if you go on to say that, oh, I'm not getting a job, you are applying for a job which is quite privileged and not everyone gets it. So, and you're applying it in NHS and UK. So you need to behave in certain manner. They need to understand. And certain very simple points like how Aishwarya highlighted, start emailing the consultants. Maybe you don't get the job that they have highlighted this time, but the consultant has your email. They know that you're someone who's quite keen. Next time they have a job in the same department, maybe you get highlighted when you put in an application, you get shortlisted, and then they see you for the person you are. Because they won't see you for the person you are until you get into the interview process. So until then, it's all play of words. Use your different models like Chat GPT and Perplexity if you want to make it sound much
Improve it.
better. Yeah. But it has to have that personal touch, as I said. You need to understand your lackings, not just you don't sound too cocky in there. You need to understand that you have to be someone who is willing to grow and improve.
Yeah.
Perfect. Okay, so now we are in a state of taking some questions. I'm pretty sure that for the last 2 hours we were talking a lot, right? But now, so I think like lots of candidates have their questions in their mind. So I'm opening the mic for all of them. Everyone can please raise your hand, and if you have any queries, you can ask to me or Dr. Harshal and Dr. Ashwarya especially. Okay, so anyone has any questions, it could be like silly questions or whatever it is, you guys can ask and you can have some
There are no
clarification for that.
even silly questions at all.
Yeah. But my past experience is all the candidates are shy, right? They really don't want to ask. I don't know why, right? They really don't want to ask in
You
front
can
of
put it in
all of
the
the
chat
candidates.
box. You guys can put
Yeah,
it in the
you can
chat
put.
box.
All right,
Someone.
we got one Zoom user. Yeah, so Dr. whoever it is, you can talk and you can ask your question, please.
All right. I wanted to ask, with regards when you apply in Ireland, let's say Dublin in Ireland, I didn't see it on the deanery. How does that process occur? Is it the same as the ones in the UK, like what he explained?
So regarding Ireland, they have it would have their own track applications. We don't know too much because truthfully we didn't apply for Ireland jobs ourselves, but they do have their own track jobs, and I think they have their own application processes as well. It's just a different site that they go through.
Yeah, even Wales has its own, I guess.
Yeah, I think
And
yeah.
there are 4 or 5 sites, I guess, through which you can put in applications. If you're asking about Northern Ireland, that forms the part of UK. So that I don't think so that has anything different.
Yeah, I think that should come under track
yeah.
jobs. Northern Ireland should come under track jobs. If you're talking about the southern and proper island, that would have their own then.
Yeah, we're not too experienced to answer that
Yeah,
question, I would say. We did not apply to those
Ireland,
those places.
All right. Thank you.
Sorry.
All right, next, I think Dr. Aftab wanted to ask any question, maybe. Dr. Aftab?
Thank you for the nice presentation, Dr. Herschel and Dr. Ashuria. It was really great to hear what you people just explained. I just want to say that I am I just completed my MS and MCH. Like I'm yet to clear my MCH right now, and I just want to know after this MCH, is there I'm yet to pass my Part B too, like I'm applying for this next Kolkata session in September. Is there does it goes down into the career flow in the pathway there? Like, is it like a disadvantage of clearing these things and thinking of UK after this?
If you don't mind us
Are
asking,
you
what are you specializing in?
trauma surgery and critical care?
So I think what you're looking at is the left side, was it? No, right side. Right side
yeah.
of the
So would you be,
photo that she
would you
saw.
be the question would be if you're interested in the training route to become a consultant or the Caesar route to become a consultant?
I want to I just want to get some experience from UK. Like I want to do fellowships and obtaining that. Is there a problem in getting that too?
No. I think what I am looking at, Dr. Aftab, is since you will be completing your MCH, you would be someone who's quite trained already and knows about the very basic stuff as well as the complex stuff as well. So there are very good trauma centers in UK. You can keep an eye on that. In London, it's St. Mary's. Aishwarya's Hospital does good as well, Royal London. There are various hospitals around UK. So you can search for these hospitals specifically and apply for posts like trauma lead or a trauma specialist registrar. There are posts which open up in specifically for trauma, which is because over here general surgery can choose to become emergency general surgery. As a general surgeon, you can choose to become an emergency general surgeon. You can become a colorectal surgeon. You can become a breast specialist. That's it, right?
There can be colorectal,
Upper GI,
HPV, breast, emergency, or just general surgery and trauma.
Yes. So I think that is one aspect that you should understand. ST3, ST4 until ST5, you do a general surgical kind of a job, and then you get a chance wherein you want to choose a specialty and start doing training in the hospitals wherever the specialty is, from ST6 to ST8. So that's when you choose whether you want to become an upper GI surgeon, you want to become a breast surgeon, you want to become a colorectal surgeon, or you want to just become an emergency surgeon. So that would be a good opportunity for you to search for hospitals who do.
I think
Okay.
specific for you, if you're interested in just some years of experience in this area, then you could apply for those jobs as rightly mentioned on track. But mind you, it won't be a complete fellowship that you would take home as a certificate or a diploma or something. That would be, as Harshal mentioned, to look specifically for fellowship programs that can highlight those. But you are, I mean, they would be more than happy to have you,
someone who's disqualified.
yeah, disqualified to work as a trauma surgeon. There are many people, in fact, coming from Sri Lanka, Singapore, to do some short-term work over here to get the exposure over here. And they work as trauma surgeons, as trauma fellows as well. And they go back to their countries. It's very, very common.
There's a David Knott Foundation if you want to look into, which is he's a very famous trauma surgeon who works in St. Mary's Hospital in London. He's written a book. I don't have it on the top of my head what the name is, but David Knott is the
Yeah, I have gone through that book. Yeah, thank you.
See, you're always,
Thank you so
you're
much.
always-
All right. Thank you so much, Dr. Akhtar, for your questions. Next is, I think, Dr. iPhone, there was, you wanted to ask a question also. And then we have Dr. Priyavrata, and also there is one questions into the chat box as well, if you can see Dr. Harshal and Dr. Ashwarya. So I think, Dr. iPhone, you can mention your name and you can ask your question, and then we will go for the chat box and then Priyavrata. iPhone, Dr. iPhone, you wanted to ask a question, I guess.
Unmute yourself if you're asking.
Okay, all right. So we can go
Sir, can I ask?
Sorry, hello?
Sir, can I ask one question?
Yeah, of course, go ahead.
Hi, Harshal. Dr. Harun here.
Hi.
I just want to ask, I've given a part B recently. I'm waiting for my results. I want to do FRCS in UK. So what should I do after my results? After what should be my direction? In what direction should I go for the FRCS in UK?
You want to take it?
Yeah,
Hello?
sure. Yeah.
Yeah.
So if you're interested to do your FRCS in UK, then there are two ways. One is through the training itself. You can enter the training, and one of the competencies that you need signed off is finishing your FRCS exam. The other way is through non-training, how we mentioned. So, but that means that you would need to come here and work maybe for a few years, maybe at least, I think around 2 years, because
3 years.
2 years, 2 to 3.
Okay.
Yeah, at least. Because to be allowed to write the FRCS also, you need your consultant to sign off saying that you are applicable and they can trust you to write the FRCS. They think you have the competencies to write the FRCS exam. So for that, they need a little trust, which will be gained only after some time working here.
Okay.
And
okay. Thank
That
you.
is saying that you just want to write FRCS and get yourself certified as
Yes,
FRCS.
I just want.
Yeah.
I just want to get a certificate. Okay.
Yeah.
Thank you.
Okay, we have one question into our chat box, Dr. Harshal, if you can see that.
That's one of my seniors actually from my college.
Dr. Priyanka Shaha, yeah?
So yes, she's already a trained oncosurgeon, I guess. So yes, do you want to unmute yourself, Priyanka ma'am?
Hi, Harshal and Ashwarya. It was a lovely discussion. I loved the way you told every bit of it. It was really, really interesting. Like I had no idea actually. So I thought let's just go
We did it
through
1
this
year ago.
session and wrap my head around what I really want and just get to know the facts rather than asking like frequent stupid question. So yeah, it was really, really nice. Yeah.
So yes, regarding your questions, I would say as I did mention about it because I saw your question before as well. You can do some locum jobs, and when you're working with these locum consultants, you can get your first thing is CRE HST, the Crest form signed off from them. And then get into the whole thing. About your appendicectomies, when you're doing these locum jobs, you do get a chance. Like in locum jobs, if you're working as a locum registrar in general surgery and emergency surgery, they will have theater. They won't have extra registrar to do surgeries or something like that. In my trust, especially, you have posts coming in for locums wherein they want a theater hand, or else they want someone who's doing the ED shift. So you can do these locum shifts and get your competencies signed, which is, I would say, a long process. I know you're working in breast and you want to specialize in breast eventually. For some, as I told Dr. Aftab as well, for someone who's quite trained already, the uh, non-training route, the Caesar route, actually works in your benefit. Saying that, there's a caveat here that it is a bit tiresome and it is a
Yeah,
bit
this is one thing that it's really nice in breast. Now I think Caesar is called portfolio pathway, and this is excellent in breast actually, because nowadays they are not even asking for the general surgery competencies. And like I have seen my seniors, some of them, they have gone through that by giving that FEBS exam rather than the FRCS. So yeah, if I want to stay in breast, might not be the training, but yeah, I mean, if I want to go in other places, I might like to go through the training route. Let's see. Yeah.
Highlight that I have, not that I know anyone, but I have heard that there are people who have directly come from their home countries into training here. It again, I don't know them personally, it's just something I've heard. I'm not sure how they got their Crest form signed off with the NHS aspect. Maybe they've done a clinical attachment here, or maybe the consultant they worked in their home country could sign it. But there have been possibilities of that happening. It's just not something that we are very well aware of. But
Dr. Aishwarya,
appendectomies, while
I know one circumstance is like there is one professor. He's also working in UK and he's also working in Bangladesh, right? So one of the uh, one of the colleague he did did the clinical attachment under him, and like as he is working in both of the countries, right? So he's a eligible person to sign the Crest form as well, right? So that can happen as well. So you can have the Crest form signed in, and you can go straight from the other countries as well without being working in the NHS.
yeah, perfect. So something like that would help a
But
lot
it'll be a bit difficult and
yeah,
a bumpy ride because NHS
to
system is a very
understand the
different system.
Mm.
I personally wouldn't advocate that, but if it works for you guys,
yeah.
yeah, it's something if you can do and handle, it's fine. But NHS is a very different system than what we are used to working, I would say.
Yeah, and regarding appendectomies, truthfully, you can get your appendectomy signed off from your home country as well.
Yeah.
You can just get your logbook signed from your home countries, add the logbooks of whatever you've done in NHS, and it's completely accepted.
Okay, excellent. Dr. Priyavrata, you wanted to ask a question, I guess? Thank you,
Yeah,
Dr. Priyanka
hi.
ma'am. Hello, Dr. Priyavrata.
Uh,
Yes.
Hi. This is a really illuminating session. I wanted to ask you two things. One, I'm a plastic surgeon. I have just recently completed my MCH. I was wondering what are the opportunities for a plastic surgeon who has completed MCH, like similar to what the previous person had asked about trauma surgery. Like a short stint in the UK, where would be a good place to get good exposure where I can, or a fellowship of sorts. Anything you could share about that?
So there are places. I've met one plastic surgeon who's a consultant who was trained in India, came in here. Uh, I met him through the ATLS course. So there are few centers of excellence that you can come in and just attach yourself as a senior clinical fellow. The job profiles usually for any fellowship are that you cover an on-call rota as well, along with the theater sessions. So you need to, so these are not completely visible on track. At times, you might have to get in touch with consultants around UK who will be happy to put you through someone and then get you a job. What happens is these fellowship jobs, they get filled in very soon because first thing is they're very few. Second thing is they're very high in demand. So usually the consultants from European nations, they finish off their training and they come and attach themselves as senior clinical fellows for specialization. Like my hospital has St. Mark's attached to it, which is a colorectal center. So they get 1 year fellowship every year, wherein they get consultants from Europe, few of them are from India as well. They come in, they learn if they want to do pelvic surgery, if they want to do ARs and APRs, robotics and stuff, they come train themselves and then go back to their own countries. So there are some center of excellences. Plus, if you ask me specifically, I don't remember them at the moment. Although I had a discussion, there are few of them. You can come and attach with them, especially the cancer hospitals like Royal Marsden and all. They have these soft tissue tumor fellowships and stuff. So if you want, you can get into that. That is one place. I think that is the one place that I remember specifically.
And when we come there, at what level of training, like what would be our level assigned to us? ST, would we still be ST3, ST4, or would it be at ST6?
Forget about the ST3, 4, 5, 6 for you. When you come from any other country into NHS, you just trust grade registrar. That's it. You are senior clinical fellow, your trust grade registrar. If I may take you back to the slides again. Yeah, so this is where you are. So anywhere from any other country you come in, you guys can see this, right?
No,
No,
it's
no.
not visible.
Sorry.
You need to share it once again.
Yeah, just reshare it.
Yeah, cool. So you come in from anywhere, you are here. Registrar level, senior clinical fellow, or else specialist doctor, SAS.
Yeah, so you can come in as especially with your experience, you can come in as a specialty or a specialist. So that's a SAS doctor. The thing is that you will still be working alongside registrars. So that will be your job profile. But your payment, your opportunities, everything will be a little higher because you have the previous experience already and you're considered as a SAS doctor.
But mind you, you are someone who's at the consultant level, if not less, in your home country, and you will not be given the same opportunities and same prestige or honor or whatever you want to put in words as a consultant in here.
Yeah, you'll be working.
You will
You'll
be
be doing the
a
honors.
training registrar under a consultant, non-training registrar under a consultant. That's it. With colleagues who are maybe less trained than what you are. That can be a bit challenging and daunting when you start,
But
frustrating as well.
yeah, but it's actually very nice. You get used to it. And once you've worked up the ladder and once they've trusted you and they realize your competencies, they do give you the importance that you require.
So from there, you can, if you've worked for sufficient time, you can opt for a certificate of eligibility for specialist registration. Is that the way it works?
Exactly.
Okay,
Yes.
okay.
But that has competencies. So I don't think so. We told you regarding competencies. The competencies are basically for general surgery. If you want to do upper GI, you should have certain number of laparoscopic cholecystectomies
Yeah,
done,
which keeps changing.
exploratory laparotomies done. There are many aspects to it. So for vascular, it might be laparotomies, vascular surgeries, transplants and stuff. For general surgery, emergency surgery, you should have some trauma as a background. So these are competencies that you need to work while you're working as a registrar in the system. So it might take you 3 years to do that, or 4 years to do that. They might ask for some teaching programs that you should have done. So you do that along the line while you're working as a registrar, and then submit your application saying that, okay, now you've gotten these competencies completed, and now you can work as a consultant.
So roughly how many years does that take usually in whatever you have seen?
We have heard about people doing it in 2 or 3 years. We have heard about people doing it for 15, 20 years and not done it yet.
Nice. Thank you for the reference. Yeah, great
right.
session. Great troubleshooting also.
Thank
Thank
you.
you.
Right.
That
Thank
just
you for your
one-
question.
Yeah. Just
Yeah, go
one
ahead.
thing I mentioned in the training application, the portfolio questions that were asked were from this year. Every year they can change. They can be the same, but they can change. So because previously they have asked questions on leadership management and teaching also as a portfolio question, which has completely been scrapped out in the past maybe few years. But yeah, questions can keep changing. So please keep a check on it.
All right. Dr. iPhone, you wanted to ask a question, I guess, as well. So you can ask
Um,
whoever named it.
Hi, Harshal and Aishwarya, Veena here. So,
Hi, Veena.
hi. So I know them from before. I work as a specialty doctor here in Lincoln County Hospital. So just a question that I just want to know. So apart from the appendicectomies, the other Crest forms, etc., what are the other things I can get signed off from my consultant here in terms of something that can help me apply for a training job? Like, is there anything like teaching experience, any management experience, things that we cannot get them done in India that easily? Is there anything else that I can get signed off from here, working as a non-training job?
Only those 7 questions. Nothing
Okay.
else. Just have to get through those 7 questions for
Okay,
certification.
and one more question. So in the audit part, so currently, because initially I didn't plan to take up the training, so I'm more of like supervising my juniors doing the audit. So is that okay, or do I need to lead the audit for me to put it in the portfolio?
You have to be involved in the inception of the audit. You have to be involved in the process of the audit. You have to be involved in the presentation. By involved, I mean you have to do all these 3 aspects,
Yeah.
and then you get
Okay.
the point.
So
Okay.
even if you're not the project lead, the
Hmm.
audit lead, okay, you'll get a little less marks mostly, but it is
Okay.
okay. Be involved in the audit process, the cycle, the presentations.
Okay, that's fine. Fair enough. Thank you. Amazing presentation. Got a lot of insights into how I can probably apply this year.
Thank you, thank you, thank you so much. All right. Next, I think Dr. Asmal, you wanted to ask a question, I guess. Dr. Asmal, are you here or not? Dr. Alom? No, I guess. Okay. Anyone else wants to ask any other questions, please?
Hello, I wanted to ask a question.
Yes,
Yeah,
please,
sure.
Dr.
Go ahead.
Upti.
Thank you for this nice presentation. Actually, my question is very beginner level. And the courses you have mentioned, ATLS and ALS, and from where we can get this, like from which they accept the course, from which
Uh,
source or which institution outside UK they accept the course.
so ATLS is pretty standard, so that you can get from the ATLS body. What's it called?
Yeah, if you just look it up on the ATLS site, they have
Yeah.
their own
There is a
the
specific website. Yeah. There is a specific website for the ATLS, and they are going to give you the specific centers in which countries they are organizing. So you can take those courses from there. So as you are a Bangladeshi, so the Bangladeshi ATLS course is being instructed by the BCPS, right? So you cannot, that is not eligible for the NHS. Remember that. But there is a
Yes,
certain
yes, that's why I'm
there is a
asking.
certain website of ATLS which you can go and you can pick the centers. Maybe you can go for the India, or maybe that can be done from Egypt, Cairo, or maybe in Dubai. So you can go that. Also, the RCS will also provide that as well, right? So you can have it from England as well. But from here, it is not done. Also, for some of the other relevant courses like the BSS, the BLS, the ALS, and the ATLS. So about the ALS as well, they will only verify or recognize the European one or the NHS one. Otherwise, they are not going to recognize the American ones as well. So remember that as well. And also, the CRISP is only I think that is done by the RCS England, right, in India.
That means we have to do it from the RCS England website.
Yeah.
Mostly yes.
But we currently are working in, we've certified ourselves as ATLS instructors. So RCS England does put up a list of ATLS courses that's going to be happening this year. They already have the schedule for this year. So I don't think so that's going to change at all. You can enroll on any one of these and get yourself sorted with ATLS in England. I know it's a bit of a pricey affair, but something that is necessary. ATLS at least. Yeah.
Do they arrange these courses anywhere else, like outside UK, anywhere else?
Yeah, as Atik sir said.
Yes, in
Yeah.
India, in Cairo, in Dubai.
Oh, okay. Okay.
I didn't know about the Bangladesh part as well, as in that's something new for me. So
Yeah.
something that I've learned today.
Okay, thank you. Another question is the work experience. What is the preferable thing? Is the training job or non-training job, like medical officers, medical officer? Will any of them will be preferred or same equivalent?
So you're telling me that you worked as a medical officer and whether it will be recognized as a work experience in NHS, is it?
Is it recognized or when I'm HCPS training, will it be upper hand?
None of the trainings done outside UK are actually recognized as trainings. They will be recognized as jobs and experience in that specialty. So even if I say that I was trained as a MS or MCH urologist in India, they wouldn't recognize me as a urologist in UK. They'll just recognize me as someone who has done a house job or a registrar level job in urology back in
So
the.
basically, that is experience, the years of experience that you have. That will
Yeah.
increase, but they are not going to recognize this as a training, whether you are going to go for a master, MS training, or the fellowship training. So all of this about the medical officer job or the training post, all of this will count as a years of experience in NHS.
Okay, both of them will get the same value.
Same thing, yeah, same thing.
Okay.
So
Only
do
thing is
whatever you are doing currently.
Like a medical officer job.
Yeah, do
So
whatever you are
And I
doing
have
right currently.
you can tell medical
quitted
officer.
my training to FCPS training. I have quitted for few reasons. That's why I'm asking, should I rejoin the training or continue the medical officer job? Which will be get prioritized? That's why.
So although experience-wise it might be the same, if you're getting more opportunities in the training which can improve your portfolio, then
Yeah.
maybe that's a bonus for you.
Okay. Thank you. Thank you so much.
Okay, next is Dr. Adrenaline. Mention your name and ask your question, please. Thank you, Dr. Upti, for your valuable question, please.
Thank you for hosting this nice session. I would like to
You're
ask a
welcome.
question. I joined a bit late, so I don't know if this has been discussed already. If it has, I'm sorry for asking it again. What I would like to know is we've heard recently that the NHS is trying to give their training posts to their local doctors. So, what does that mean for us international doctors who are giving the MRCS and hoping to get into training posts in the UK? And if this such a case arises, then what are the prospects we have for the MRCs if we go and we can get training jobs? Are there any lateral entry ways that we can get into training jobs? I hope my question is clear.
Thank you.
So two questions there.
Two questions.
One is that whether the local trainees are going to get more opportunities for training over the IMGs. Yes, there has been a big discussion about this. BMA is pushing for it. There's been a lot of fiasco around it. At the moment, although there is no clear-cut information, I would say there is a strong sentiment that the local trainees be given opportunities over the IMGs, uh, which has their own points. Let's not get into the discussion for that, but I would say that yes, there is a bit of resistance for the IMGs to be taken into training over the local candidates who have done the medical schooling, who've been working for their applications in here. So yes, that is happening. I would be honest with you, but that was a fact when we applied as well.
Yeah, exactly. It's something that's been in the talks for a while, and it's not coming to fruition. So it's not something that's been applied yet. So we can speak about right now. Right now, it's not there. We don't know in future how it will be.
Yeah. So we would say that it was going on since past 10 years as per our consultants. This year it's been a bit stronger of an push by the local graduates. But you have both of us in front of you who've gotten a training post. So it is not impossible. It will be difficult. You will be competing with your mates and your colleagues in the process, but it's not impossible. You might have to work a bit extra and give that edge to your application.
Both of you have entered into the training post in the most crucial time of that we have ever had in our life, right? So I think yeah. Another question he asked, is there any other pathways to enter into the training post? So I think you have already covered that. the CSR route, so other routes that you can have to in order to become a consultant. That is not a training post, but like ultimately the job will be done as a consultant post. So you have already talked about that as well.
And Oriel is the only way you can get into training program in UK.
Hmm.
No.
Hmm.
Thank you so much. Thank you so much for answering the question.
Thank you for your question as well. All right, is there anyone else wants to ask any other queries? If you have, you can ask now. No? All right, so I think we are going to call it a end here, I guess. Okay, and we will be always here to lend you the hand whenever you need. So get in touch with me or with Dr. Hal and Dr. Ashwarya as well. And thank you so much, Dr. Ashwarya and Dr. Harshal, for being here and give us such a beautiful presentation and also about the lots of information, and I'm hoping that will all immensely help all the candidates who are hoping to complete the MRCS or already have completed, or maybe they are waiting for their Part B results and they're hoping to enter into the jobs, right? So this will help them immensely in order to get a jobs or either entering into a training post as well, right? So thank you so much, and hopefully we are going to make some separate sessions for like the audits and the QIPs and the research, and also maybe some CV and portfolio building, maybe if they are going to ask for that.
Yeah.
Yes.
Yeah, sure.
And we'd
Any?
really everyone give a feedback. If there's something that you'd like us to improve on or something that you think needs to be tackled, then I'm sure Atik sir and us are happy to help you with it.
Cool. All right, we'll put in the links as well for the Crest form, and I'll put in a feedback link as well in the group, Atik sir, if that's fine. Yeah.
Yeah, fine. Perfect.
Thank you very much for doing this, Atik sir. Always a pleasure to see you. This time it was just us on the other, and there's
Yeah.
no one. But yeah, love.
No, I
Uh,
feel really proud, I really feel proud that both of you are there. And just like it's a matter of 1 year, right? So you were here, you were listening to the course classes and all that stuff, asking the questions and all that, giving the mocks, right? And now you're there doing these fantastic jobs and like creating a very, very good amount of like opportunities for all the other candidates who are looking for their dream as well, right? So it's like I feel really, I'm really proud right now for having you both of you here. Okay, any last word you want to give to the future candidates and the future adventurers, like persons who ever want to have this like you? Any last words?
I would just say go ahead, give your exams, finish off your MRCS. Whether you get a job or not, it's going to be secondary, but at least you'll have learned through the process. You'll have a degree to yourself, and it's always a good experience to do the whole MRCS pathway. And not even just get trained in UK, but at least come in here, see the system. I've learned a lot from the system. I think I'm falling in love with the system more and more every day I work. It's a system. Don't pay hindrance to Facebook groups or anyone else who's giving you negative vibes. Frankly, take it from us. We've done it. We could do it with support and love from people, and all my professors who back in India, all my seniors in back in India, who have helped both of us actually. So it is doable. You can do it. You're seeing someone who's done it already. So yeah, best of luck, Aishwarya.
Yeah, I completely agree with everything Harshal said. We've had a very good guiding force. Atik sir, our seniors back in India have helped us completely throughout the process. And I also think we grab the right opportunities. So I think it's really important that you work on yourself, make sure that you know what the check boxes you need to tick, and make sure you get them ticked. Make sure you completely fill in your portfolio if you're going for training. Make sure you got your essential criteria if you're applying for the track jobs. Make sure you're showing yourself as the best candidate they can have. And I'm very sure you can get the jobs. It's completely possible.
Perfect. All right. Thank you so much.